Welcome to today's press briefing. We have two doctors with us today. Dr. Albert Au, Principal Medical and Health Officer of Communicable Disease Branch Center for Health Protection, and Dr. Larry Lee, Chief Manager of Hospital Authority. The two doctors will give us an update on COVID cases and HA situation. Dr. Lee will have the floor. Good afternoon. The HA has 2,793 patients in the facilities altogether, with 355 of them being new cases. For those requiring isolation facilities, 572 are in isolation wards, 166 are in second-tier wards, and 590 patients are in Hong Kong North End Hospital, Hong Kong Infection Control Center, and 233 in Asia World Expo Treatment Facility. And among them, 252 are new patients. There are also 8 new patients in critical conditions. 5 had 3 jabs, 1 had 1 jab, and also 9 more patients in serious condition. And among the inpatients, there are 64 in critical condition and 54 in serious condition. 18 in critical condition are receiving care in the intensive care units. As for death cases, there are 8 more deaths, 4 males, 4 females, aged 59 to 102. 6 deceased patients did not complete the 3-dose vaccine regime. 5 had 2 jabs and 1 did not have any vaccination record. 4 were care home residents. Let me say something about the 8 death cases. 5 patients had linkage with their COVID condition. The first patient, 92-year-old female patient, she had 3 doses, a care home resident. On the 21st of August, she was admitted to hospital via A&E unit of Eastern Hospital because of poor appetite. And after being admitted on the 27th, she was found to be positive for COVID with a CT value greater than 30. Her condition continued to deteriorate, and on the morning of the 3rd of September, she passed away. Second patient, 81-year-old male, 3 doses of vaccine administered. He had pneumonia on the 18th of August. He was admitted to A&E unit of Queen Elizabeth Hospital because of coughing, and he had low blood oxygen level, and he had pneumonia. On admission, the CT value when tested PCR positive was 22.8. And 5 days before, on the 13th of August, he also tested RAT positive. And in Queen Elizabeth Hospital, his condition was stable. On the 23rd, he was transferred to Wong Tai Sin Hospital. His condition deteriorated, and he passed away on the 3rd of September. Third patient, 82-year-old male, no vaccination record. He had ventricular fibrillation and a heart condition. He was admitted to A&E unit of Eastern Hospital because of shortness of breath and sore throat on the 1st of September. He tested positive for both PCR and RAT. He was admitted then in Siu Sai Wan isolation facility, and his condition continued to deteriorate after being hospitalized, and he passed away on the 3rd of September in the afternoon. 93-year-old male patient who had arrhythmia and atrial fibrillation. He was admitted to hospital on the 26th because of low blood oxygen level. He had pneumonia, and after being admitted to the medical ward on the 3rd of September, his condition deteriorated. He also remained unconscious until he passed away. Another patient, 102-year-old female patient with dementia, on the 24th of August, she was admitted to hospital of Yan Chai Hospital. She tested positive. She was admitted because of fever and low blood oxygen level, and X-ray examination revealed pneumonia. Her condition deteriorated, and then she passed away on the 3rd of September. As for the 3 other patients, the cause of death, we believe, did not have direct correlation with COVID. 73-year-old male patient, 2 doses of vaccine because of fever and weakened legs. He was admitted to A&E unit of Tin Shui Wai Hospital, and then a blockage was found in the artery in the abdominal area. Operation was performed. He then passed away. 93-year-old male patient admitted via A&E unit of Princess Margaret Hospital on the 26th of August. He was then transferred to the Hong Kong Infection Control Center of Hong Kong North End Town Hospital, but because of low blood pressure and low red blood cell count, he was then transferred back to Princess Margaret Hospital because of internal hemorrhage. And then the final patient, 59-year-old female patient who had terminal stage breast cancer and renal failure. She was admitted on the 29th of August to the oncology ward. Her condition was poor. She tested positive, and her cancer condition continued to deteriorate, and she passed away on the 3rd of September. 295 patients recovered as of yesterday. 261 of them have been discharged, and 7 patients tested positive via hospital admission screening, and 12 patients sharing the same ward are listed as close contacts. HA staffers, 127 of them being newly infected staffers, and 21 of them have resumed their positions. We'd also like to make an announcement in relation to the medical ward of Yan Chai Hospital. 3 male patients from 64 to 83 and 1 staff members have been infected with COVID, and the 3 patients shared the same cubicle with the 84 male patient who had earlier tested positive. The 3 patients are in stable condition, and we've suspended visiting arrangements for this ward, and all staff and patients have been arranged to undergo testing. Thank you, Dr. Lee. Let me report the COVID-19 situation as of yesterday, the 3rd of September. As for local cases, there are 10,490 cases, including 2,937 PCR positive cases and 7,555 RAT positive cases confirmed via PCR. We also recorded 193 imported cases, including 164 PCR positive cases and 29 RAT positive cases. There were also 8 more deaths recorded, as reported by Dr. Lee just now. So far in the 5th wave, the total death count now stands at 9,511. And among the death cases, 96% of the deceased were age 60 and above. So for this age group, 86.6% of them did not have any vaccine, or only had 1 vaccine. Now, for those above the age of 60, the morbidity rate is high. And for the unvaccinated, the percentage is 7.83%. Whereas for those who have had 3 jabs and above the age of 60, the same rate is only 0.14%. So that's a 56 times difference. For those with 4 doses, the rate further drops to 0.04%, so that's a 196 times difference. As for imported cases, there were 193 imported cases reported yesterday, 75 picked up at the temporary specimen collection center at the airport, 44 picked up at quarantine hotels or quarantine centers. As for the remaining 74 cases, they were picked up at the community testing centers. 58 of them belong to the 4th to 7th day specimen, and 16 belong to specimen collected after the 7th day. These cases had high CD values, so they are believed to be repositive cases. Now, the 193 cases come from 48 countries. 5 countries have imported more than 10 cases, including India, 29, Philippines, 21, US, 21, UK, 19, and Thailand, 13. So the remaining 43 countries, they have imported fewer than 10 cases. As for care homes, as of yesterday, there were new cases for 8 homes, including 7 RCHEs involving 10 residents and 1 RCHD involving 1 resident. For these 8 care homes, altogether 45 residents have been listed as close contacts, and they'll be subject to quarantine. One is in Wong Tai Sin Gong Tai Wu Lao Zhong Sim, 1 infected, and then in Kwun Tong Zhong Shun Wu Lao Yun, 1 resident infected. The 3rd one in Southern District Sage Ho Sin Heng Home for the Aged, 1 resident positive, and then North District Tongma Group of Hospitals, Fangwang Wuntai Home for the Aged, 2 residents infected, and Chunwan Buddhist Society, Buddhist 葡提護理安老院 2 residents infected, and 香港聖公會米毛劍英 Home for the aged, 2 residents infected, and in Chunwan Caritas 恩輝院 2 residents infected, and then 1 RCHD Hong Chi Society Integrated Rehabilitation Center, 1 resident testing positive.
Over the past 7 days, 55 care homes registered cases, 42 RCHEs and 13 RCHDs, involving 96 cases. 79 are residents, 17 staff members. Today being a school holiday, we have registered no cases. In terms of genome sequencing, the PH lab conducted the test. Those carrying L452R or BA.4.5 subvariants. The trend is on the up, on the rise. Yesterday it was 64.4%. Compared with the 63.1% yesterday. For L452R cases, BA5 at the moment makes up about 56.7%, BA4 7.7%, BA.2, 12.1 yesterday, it makes up 6.3% of the total. For the others, the other Omicron BA.2, that's 29.3%. It's now time for questions. Please identify the organization you represent. The one in white shirt on the front row, please. Cable news. In the U.S., approval has been given to the use of the second bivalent vaccine. Will this be made available to the members of the public, and will you be enhancing the vaccine pass to cover 4 jabs for someone to be considered fully vaccinated? And also the patients in the same ward that come down with COVID, are they related in any way epidemiologically? Right, for the first question about the bivalent vaccine, the government has not received any application for recognition of this vaccine in accordance with the 599K, the PCDO, the importers, the distributors can make the application, and also having regard to the views of the expert committee, we will consider the efficacy, the safety of the vaccine, and the COVID-19 vaccine can be approved, and the DH will also proffer professional advice. The Joint Scientific Committee will also have regard to the empirical data of the vaccines and also the advice of the WHO and make new recommendations in this regard. We'd like to remind the members of the public that COVID is in a dire situation, and the community cases are pretty high, and there is a high chance of transmission in the community. If people can take the jab in a timely manner, they should listen to the advice of the scientific committee and get inoculated in order to have sufficient protection against COVID, and that would enable people to have good protection in such a way that these will guard against the possibility of severe cases or even death. Now, for vaccine pass, I'm sure the government would consider all the factors before making the most suitable arrangement. For the Yan Chai Hospital, in the medicine ward, there are 5 or 4 patients and 1 staff member who come down with COVID, and we identified an 84-year-old male patient who was probably the source of infection, and we are conducting the contact tracing, and we will certainly bring you up to date on the latest. Next, please. Gentleman on the left, please. AM 730. Now, there are suggestions that there are family members who test positive that never declared their cases. Under what circumstances would they have to make the declaration? And for the Yan Chai Hospital, what is the role of the position of the staff member, and any update there? An 82-year-old male who passed away. He was in the holding center, and under what circumstances was he sent to the hospital, and what is the outbreak like in that care home? And the nighttime consultation service at the David Trench Hospital clinic will be suspended. How much more manpower will be spared? Right, in terms of declaration, now if people are conducting RAT test, if one tests positive, one has to make the declaration on the platform. It's only with the declaration that we would become aware of the cases, and we will then be issuing the isolation order to the patient and the quarantine order to the family members. And depending on the household situation, we can arrange for isolation facilities to be arranged, and the hospital authority will also disseminate the right message. If they need medication, if they need tele-medicine, tele-consultation, if they need consultation at the designated clinic, arrangement can then be made. There are some people who may not be well up in the internet, and we do have a hotline. The number is 183-6119, 183-6119. Now, for those who are not well up in the internet, they can ring this hotline and leave their telephone number and their ID. We will get in touch with them as soon as we can. If they do experience difficulties, we can certainly make the declaration, help them with the declaration, and issue them with the isolation order. And that's terribly important. And we would look at these declared cases. Each day, we will receive dozens of such cases by telephone. We will follow up on them. Right. In relation to your questions, the cluster at the Yan Chai Hospital and the staff member involved is a nurse. Now, for the wedding banquet cluster, we don't have any follow-up. For the holding center at Suicide 1 on August 27th, the patient was sent to the holding center at Suicide 1 from a care home. And in terms of RAT and PCR, they come back positive, and the situation deteriorated. There was shortness of breath, and the patient was sent to the PYNEH A&E. I don't have any further information. As to the David Trench and also the GOPC, at the present moment, the family physicians are also responsible for the designated clinic, and they also have to be responsible for the tele-consultation. So we have made adjustment to the services in order to deploy more manpower resources to support the tele-medicine. Next, please.
Yes, this lady on the left-hand side, front row. I'm from Ming Pao. About today's survey, 12% of senior citizens age 60 or above did not report their positive result. In the past week, how many severe cases or death cases have been found to not have reported their positive status, leading to a delay in their diagnosis and treatment and causing the cases to be severe? And it said that there is a hotline to help those who find it difficult to make a report of their positive status. Now, how many lines are available to provide this service? And about the death case, you mentioned 4 death cases who were care home residents, apart from the 92-year-old female and 82-year-old male and 102-year-old female. Which other death case was a care home resident? The hotline is 1-833-6119. So members of the public may ring this hotline. This is an automated hotline. And once the line comes through, you need to key in your own phone number, and then we'll keep this information and ring the caller to get more information and help them make the declaration on the platform. And we'll also help family members to make this declaration on the platform. Dr. Lee, about care home residents, I'm afraid I need to check the information at hand. I'll supply this information later. About severe cases, those in serious condition, we don't have any figures at hand as to whether they had reported their positive status or not. But of course, from our perspective, we do encourage members of the public to make a declaration if they test positive. First of all, our colleagues will contact them, and we have a hotline for the high-risk group and elderly citizens. We take the initiative to contact them to get information and see if they'd like to make a booking with a doctor. Now, for senior citizens and high-risk patients, if they could receive treatment earlier, they could be prescribed with oral drugs, and according to medical literature, the fatality rate could come down by 80-90%. So we encourage members of the public to report to us if they test positive. And from Now TV, my question is that the daily caseload remains at the level of 9,000 to 10,000. Are we entering a plateau, or will you estimate a further increase? Well, there are 4 death cases today. 4 of them were care home residents. Why do you think that the cause of death for these cases is more likely to be COVID related? And can we conclude that care home residents tend to have a higher fatality rate if they get hospitalized? In the past few days, in terms of the daily caseload, it has surpassed 10,000. And in the past 2 or 3 weeks, the figure continued to surge, albeit not at an exponential rate as what we'd seen in March, but still, starting the middle of the month, the rate of increase is further exacerbated. The daily caseload increased from 5,000 in early August to 10,000 now. So in the short run, we do expect this upward trend to continue. We also have other indicators such as the real-time instantaneous effective reproduction number, and that's 1.35 according to the Hong Kong U. If it goes beyond 1, that means one person can infect more than one person. So we do expect the daily caseload to further increase. So unless this number drops to 1.2, the epidemic situation is unlikely to ease. And also for the sewage surveillance samples, in the past 5 consecutive days, there were 500,000 copies of viral load in the sewage sample. And again, we notice an upward trend, and we do expect that the upward trend will continue in the near future. And so far, there is no evidence to suggest that we've entered a plateau. So we must not let our guard down. We must continue to observe anti-epidemic measures and get vaccinated. The other concern is that BA.5 has gradually become the major subvariant in Hong Kong, and because of its high transmissibility, it's likely that the virus would spread more quickly in the community with more transmission chains. And we understand that some people having been infected in March during the peak of the 5th wave have yet to get jabbed. And it's been quite a while since March. And we believe that the level of immunity regarding this group of people would have dropped after so many months, leading to a high infection risk. So this would affect the caseload. About care homes, there are fluctuations. We have 8 death cases, with 4 of them being care home residents reported today. And among the cases I reported earlier, 3 of them were care home residents. Now, we don't want to say whether it has anything to do with residential care homes. Safe to say that, according to our observation, the majority of death cases belong to the senior age group. And for senior citizens, whether they stayed in the community or in a care home, they are in the high-risk group because of the underlying illnesses, and the only related factor is vaccination. If they remain unvaccinated, the death rate is higher. That's according to various experts in the Department of Health. So I urge everybody to get jabbed as quickly as possible. If there are no other questions, that's the end of today's press briefing.